Last time we checked in with Bridgeport Mayor Joe Ganim, his city had a relatively low number of coronavirus cases compared to surrounding towns. Unfortunately, in the couple of weeks since then, that number has jumped up considerably, and Mayor Ganim joins me on the phone now. Mayor, by no means does this represent a failure on anything you're trying to do to stem the tide. I guess it's just more of a geographic inevitability at this point, right?
Yeah, we follow. Thanks for having me on. We follow New York very closely. I don't mean that we follow the news there, but I mean with the numbers. You see Stanford, which is about halfway between Bridgeport and New York, is about 1,200 cases. We're at about 712. So, and Norwalk is a much smaller community, but about the same number of cases that we have in Bridgeport. So geography plays a huge role in this. I do think there are measures that have helped us keep our numbers down by comparison to some of the other towns. People have been great, and I know every city and town, I think across Connecticut and beyond, are really taking this thing to heart. So we've been lucky on that. The other thing that I think is real important, it's probably worth mentioning, because I've had this conversation with the hospitals. There's about 1,000 beds normally in Bridgeport. Now there's more with some of the additional space. It's how many people are occupying hospital space, how many need attention, critical attention, and then how many are being discharged. Those numbers, and I can certainly share them with you generally, are really good. It doesn't take away from the one, we've had 10 people died and so on, but it doesn't take away from that. But those are the critical numbers that will help us get through this critical period for probably the next week or so.
And that was the whole idea behind flattening the curve, was just to try to keep the hospitals up and running without getting saturated. So you're right. That's as much of an indicator as anything. Talk to me, Mayor, about the voluntary curfew that you put in place. Was there much resistance to that? How did the city welcome that?
No, actually, the grocery stores spoke to me. I called most of them. Some are owned multiple locations, and said, look, we close at 8 o'clock anyways. Our employees come home. We have customers leaving, and that's fine. This isn't like, use the light switch kind of concept. It's not that. It's please get home as quick as you can. Let's try and minimize. Let's pick a time in the evenings when it's less disruptive. Boston we modeled ours coincidentally at the same time Boston did theirs. And theirs is at 9 o'clock. So it's been working very well. I do think there's other measures that we need to put in place and continue to look at opportunities to make people safe and flatten the curve. I think more masks, which we may, again, in a suggestion, I don't like to order stuff, but if we have to, well, once we get to the point where people can use facial cover everywhere they go, when they go to a grocery store, pharmacy, and everywhere, I think that would be helpful. If they're out in public, even in the parks, anytime you have the opportunity to have hand covering gloves is critical. So those are the things I think we need to look at more and more if people want to start having a discussion about reopening the economy. I think we're premature on that, but regardless, these are going to be the measures that we need to have in place, in my view, as we go forward to kind of see ourselves get to the end of get to the finish line, if there is a real non-moving finish line on this thing.